Welcome back. Eyes are an integral part of our success in life. Unfortunately, the loss of vision is all too common and often the result of other chronic medical conditions. The goal is prevention, but there are some great tools out there that can assist with detection and treatment. I talked with Dr. William Wood, founding partner of Retina Associates of Kentucky, about the problems along with the tools and technology they use to keep those eyes working properly. As our population ages, we are living longer and longer with chronic medical conditions such as diabetes and hypertension. Unfortunately, both of these present significant risk to the eyes, especially diabetes. The key is early identification and thorough management.
Diabetes is exploding in prevalence and incidence. As a matter of fact, Kentucky has one of the highest rates of diabetes of any state in the United States. And early treatment and diagnosis is a key to saving vision. And diabetes is a leading cause of blindness in younger people in the United States today, and it's increasing dramatically.
In order to understand the problem, we must understand the anatomy of the eye and how diabetes affects the eye.
Both of these types of diabetes affect the retina. Now, if we look at the eye, as we can see here, and if we have a cross section of the eye, if we open up the eye, we can see that the nerve going to the brain is here, in the front of the eye here, which in the light rays that we see goes through the front and into the back, and the retina lines the entire inside of the eye like an inner tube does a tire. It's very thin. It's half the thickness of saran wrap, and it is a neural tissue composed of 1 million nerves, and they all exit in a bundle or a cable of wires to the brain and through the optic nerve. The center of the retina is called the macula, and that is just an area of the retina that allows us to have very fine vision, such that when you look at me, you can see my nose and my face, and also color vision. And both types of diabetes affect the retinal blood vessels, primarily, that you can see here in the arteries and veins that nourish the retina, and cause swelling in the macula. Both types of diabetes can cause blindness.
The key here is timing. The damage to your eyes from diabetes is related to time and control of your sugar levels. Dr. Wood discusses the diagnosis, timing, and prevention.
We recommend, therefore, that if a patient has newly diagnosed type 1 diabetes, it's unlikely they're going to get any diabetic problems for 5 years. So we recommend at 5 years a patient have a very thorough examination of their retina by someone trained to look at the retina. If someone develops diabetes and they're type 2 diabetic, say when they're 40 years of age, they need to be examined immediately because they could have had diabetes for 5 or 10 years and could be at high risk for blindness on the first day of diagnosis. If a woman who is diabetic becomes pregnant, she is at immediate high risk for loss of vision, and she needs to be examined at the time of diagnosis of pregnancy if she's had diabetes. The second thing that is important is the relation to blood sugar and control of blood sugar. We now know that if a person has very tight control of their blood sugar, they can prevent most of the dreaded complications of diabetes, including kidney failure, diabetic retinopathy, blindness, amputations, heart attack, stroke, and a long list of complications.
Blood pressure management is very important as well.
The systolic blood pressure is a very adverse factor toward loss of vision. We want to keep people's blood pressure with diabetes around 120 to 130 over 70 or 80. If blood pressure is 140 over 90, there's about a 15 or 20% increased risk of losing vision, and it goes up every 10 units. And so we educate our patients about blood pressure also.
There are several tools that are utilized at Retina Associates of Kentucky to help evaluate and monitor the changes associated with chronic medical conditions. Some of these tools include wide-field angiography and ocular tomography. The advancement in the technology allows detail and diagnosis that was difficult, if not impossible, in the past, as well as non-invasive monitoring of the conditions and treatments. These methods haven't come at a moment too soon for the citizens of the region as diabetes rates continue to climb.
Diabetes in the state of Kentucky is increasingly blinding more and more people. People are not aware that they need to control their blood sugar, their blood pressure, and when to be examined, which I've outlined, and to be sure that they're being checked so that these problems can be identified and treated early to prevent blindness. So that's just one of the areas in which we work very intensively at Retina Associates.
Diagnosis is only important if there's something that you can do about it once you find it. Thankfully, several strategies have been developed in order to help manage diabetic retinopathy, improve symptoms, and prevent further damage.
Treatments we have are many, but the mainstay of treatments that have been proven efficacious are injections into the eye of a material that blocks leakage and bleeding. These are called anti-vascular endothelial growth factor agents. They're a novel agent and they revolutionize the treatments and are markedly helpful. At this patient who has diabetic macular edema and swelling and fluid into the center of her eye, causing loss of vision, we give the injection, and 3 or 4 weeks later all the fluid's gone. It is really a wonderful proven treatment. These same injections are also beneficial to treat the proliferative retinopathy, where there are growth of blood vessels, because they can make the blood vessels actually regress. Sometimes you can see them and then a month later you can't even see them anymore after this injection. The second mainstay of treatment is laser photocoagulation delivered into the eye, where we're actually destroying tiny bits of diseased retina that liberate a factor into the eye, a protein that causes growth of blood vessels and leakage. And these tiny little laser marks make the eye liberate less of that factor, and so the eye reverts back to a more healthy state. That's been used for 20 years as a miraculous treatment. A third form of treatment is vitrectomy surgery, which is done currently as an outpatient basis in an operating room without involving a hospital stay or sutures in the eye, and usually does not require an extensive time in the operating room. And the patients go home immediately, and the results are quite good at reducing blindness for major hemorrhage in the eye and detached retina. And then also we have a rehabilitation service related to a low vision services of Kentucky, which can help improve the quality of life by providing magnifying lenses, lights, filters, and a whole host of devices and ancillary services and financial aid through state agencies and private grants for people with limited vision.
If you have diabetes or high blood pressure, it's very important that you manage those, take your medications, and have your eyes checked regularly to make sure your eyes are staying healthy. More StantonMD is coming up.